Good morning, everyone. My name is Erin Bombala, and I would like to thank you for taking the time to watch my presentation. My research question is, what factors have influenced the rise of birthing centers in the United States? A birthing center is a healthcare facility for childbirth where care is provided by midwives and adheres to the wellness model of care, which encompasses care for the physical, mental, and emotional well-being of each patient. This type of facility is very different from a hospital birthing unit, where doctors and nurses adhere to the medical model of care, where they focus on the physical and biologic aspects of pregnancy and delivery. I chose this topic because I am passionate about women being in control of their own bodies, and also because I just really love babies and think it's only fair that they enter the world safely. Childbirth has, since the beginning of humanity, been a natural process that occurs at home, assisted by a woman's close, matriarchal support system, often including trained women known as midwives, in what has come to be known as the midwife model of maternity care. In modern times, midwives support the mother through pregnancy and provide the medical care necessary to deliver a healthy baby to a healthy mother. The medicalization of maternity care in the United States has exploded over the last 100 years, with approximately 30% of women giving birth in hospitals in 1931 compared to over 95% in 2015. Author and certified midwife Adrienne Felhuisen has found that the fall of the midwife model of maternity care throughout the 20th century has coincided with the rise of the patriarchal healthcare system, where males dominate the field, as well as advancements such as the development of antibiotics, pain management drugs, and technological advances in delivery such as cesarean sections and assisted deliveries, have all led to the medicalization of childbirth known today as the medical model of birth. In her graduate thesis, sociologist Martella Henson highlights that even with the medical developments and technological advancements of the last 100 years, the United States still experiences the highest rate of maternal mortality of any developed country in the world, as well as the highest rate of cesarean section of any country, at 31% of pregnancies, a rate well above the recommended rate the American College of Obstetricians and Gynecologists considers necessary. Henson argues that the medical model of birth does not consider the mother's psychologic and emotional experiences of giving birth, but rather the physician's ability to successfully deliver a live baby in what is considered a controlled, safe environment of a hospital. However, both doctors and hospitals seem to be more concerned with the financial benefits of medicalizing childbirth than they do with what is best for women in terms of maternal care. The horrifying truth of the matter, and the most important aspect to remember from all of this research, is that women are dying, unnecessarily, during and as a result of childbirth. Here is one devastating story.
We're talking about a woman that was a marathon runner, that raced cars, that was a skydiver.
It never occurred to him that the greatest danger Kira would face would be going to one of the best hospitals in California to have a baby, their second son, Langston.
Hey, Mom. Hey, Daddy. Hey, Langston. For us, we were really and truly expecting this experience the second time around to be a walk in the park.
It was a C-section, not because there was a problem, right?
They suggested that you had one before, and they recommended that she have another cesarean. Hey, Langston, I'm waiting on you, buddy.
The first sign of a problem came in the late afternoon of April 12, 2016, shortly after Kira gave birth.
I was sitting by Kira's bedside, and I began to notice the catheter turned pink with blood.
A doctor ordered a CT scan, a CAT scan. Johnson says he didn't worry at first.
Something's not quite right, and I was aware of that, but we've got a plan. And she's in what I thought were great hands.
And how's Kira feeling during this?
Lethargic. I'm continuing to advocate and ask more adamantly, look, when are we taking her for the CT scan? 7 o'clock rolls around. 8 o'clock goes by, 9 o'clock comes, 10 o'clock comes.
There's still
no CT scan.
Shortly after midnight, his wife was taken into surgery.
She's holding my hand and she's saying that she was scared. And I'm telling her that everything's going to be okay. Everything's going to be okay. And that was the last time I saw my wife alive.
Dr. Marianne Edebet, Executive Director of Merck for Mothers, a program run by the pharmaceutical giant Merck, to reduce the number of maternal deaths throughout the world, never expected the United States to be a country that would need her organization's services. But despite their best efforts, hospitals across the country are falling short of meeting the needs of women in childbirth. From gender or racial discrimination to overworked and understaffed hospitals, pregnant women who are trying to advocate for themselves and their children are being ignored and put in life-threatening and sometimes mortal situations by the very people who are supposed to be ensuring their safety. They plan to deliver with a trained obstetrician in a hospital setting under the guise that it is their safest option. Doctors across the nation are pushing unnecessary C-sections, putting the mother at high risk for complications. And when these complications do arise, mothers are belittled and ignored as their health deteriorates, leading to oftentimes dangerous situations and regrettably even to death. The answer to this problem for many women is to search out the services of a midwife who will provide the personalized care that is so blatantly missing from today's medical system. As I mentioned previously, despite having one of the most advanced and available healthcare systems in the world, the United States also has one of the highest maternal mortality rates in a developed country. But no matter who you are, where you're located in the world, or what your medical history is, giving birth is not without risks. From the busy streets of New York City to small villages in sub-Saharan Africa, there is an inherent risk to women and their newborns in childbirth. This risk does not change or go away no matter the location of delivery. Women die giving birth, whether delivering in a hospital suite or underneath a tree. Dr. Lori Romanzi outlines that the best way to help mitigate these risks is to provide comprehensive care that encompasses the best practices from both physicians and midwives to ensure that women get care that will help increase their odds and their child's odds of survival. Across the country, women are realizing this and are taking back control of their childbirth experiences to create their own narratives for what will work best for them as they bring new life into the world. Through birthing centers and with the aid of a midwife, many women are reconnecting to the methods of childbirth that our ancestors experienced. The result is a stronger connection to themselves and their children and shows promising results in safety and satisfaction among women. So, what did I learn? When I first started delving into the articles and studies related to the topic of birthing centers, I was expecting to find the voices to be primarily midwives with feminist viewpoints, preaching the benefits for women and the connection to their bodies' natural processes that a birthing center delivery would offer. I was very interested to find that the conversations are starting from sociologists and public health professionals just as often, focusing in on how to address maternal mortality issues and poor care levels in hospitals across the country. While there are many different schools of thought to navigate through, it was clear that the consensus among them was that there is an issue with maternal care in the United States, and it is fueled by a profit-driven medical system that misses the mark on the personal care required when treating a pregnant woman from conception to postnatal care. The inability for many hospitals to treat on a wellness level rather than just a medical level is missing a huge opportunity to provide women with a safe and satisfying childbirth experience, and thus fueling the rise of birthing centers throughout the country. What else do I want to know? There are those who think birthing centers with midwife assistance should be the primary setting for childbirth, while at the opposite end of the spectrum, there are those that believe hospitals with treatment led by trained obstetricians are the only appropriate setting. If I continued my research, I would try to determine why more hospitals are not working to merge the two schools of thought, as it seems that would be the best solution to the issue of poor maternal care in the United States. The combination of midwife care supported by hospital resources would provide the best in terms of care and in confidence that if an emergency does arise, the support system will be in place to mitigate it. It is unclear why some hospitals are unwilling to offer the services of midwives or integrate a birthing center into the services provided by the hospital, but I would be interested to delve deeper into this question. Thank you again for listening to my presentation. I hope you found my content informative and interesting, and you thought that the pictures of the babies were cute.